I want to tell you what your morning looks like right now, and then I want to tell you what it could look like. And the distance between those two pictures is the distance between a heart that is aging faster than it should and one that is being actively supported every single day. I am Dr. Calvin Hayes. I am a cardiologist, and I have spent over 20 years in clinical practice working exclusively with patients over 60. And in that time, I have seen something that genuinely shocks me every single time I encounter it. Not because it is rare, because it is so extraordinarily common. A habit so woven into the daily life of the average senior that it is essentially invisible. A behavior that the research now clearly links to a tripling of heart attack risk in adults at 60. And a pattern that I watch patients continue for years after their diagnosis because nobody has ever explained to them in plain language what it is actually doing to their heart. I am going to explain it to you today, clearly, specifically, and in a way that I believe will make it genuinely difficult for you to continue the habit the same way you always have once you understand what is happening inside your cardiovascular system when you do it. Stay with me, because the before and after I am going to walk you through today is not just about one morning. It is about the cumulative difference between two entirely different cardiovascular trajectories over the months and years ahead. And by the time we reach the end of this video, you will understand exactly which trajectory you are currently on and exactly what it takes to change it. Let me start with the before. The morning that is happening in the lives of millions of seniors over 60 right now, this morning, possibly your morning, your alarm goes off, or your eyes open on their own the way they tend to after 60, somewhere between 5 and 6 in the morning. And within seconds, sometimes within 1 or 2 seconds, you do the same thing you have done every morning for decades. You sit up and you stand. Immediately, without pausing, without thinking, because it has never once occurred to you that this moment, this 2-second movement from lying down to standing, is one of the most cardiovascularly demanding transitions your body makes all day. And then, still within the first 60 seconds of being awake, you reach for your phone. Not because you made a conscious decision to, because it is there, because it is habit. Because the notifications are waiting, and the news is waiting, and the messages are waiting, and your brain, not yet fully transitioned from sleep to wakefulness, reaches for the most familiar stimulus it knows. Within the next 15 minutes you have a cup of coffee, because the coffee is part of the morning, because it has been part of the morning for 30 or 40 years, and because nobody ever told you that drinking caffeine before drinking water, on a body that has been losing fluid for 8 hours during the highest cardiovascular risk window of the entire day, is layering multiple stressors onto a heart that is already working harder than it should be. And then you sit down, for breakfast maybe, or to read, or to watch the news, and you stay sitting, because sitting is comfortable, because the day has not really started yet, because there is no particular reason to move. This is the before. This is the morning that is happening across tens of millions of households right now. And I want to be direct with you about what this morning costs your cardiovascular system, because I think most people genuinely do not know. The standing up too fast part. Here is what that costs you. When you sleep, your blood pressure drops, your heart rate slows, and your blood pools toward your lower body. Your cardiovascular system is at its minimum demand state. The moment you stand up, gravity pulls a significant volume of blood downward and away from your brain and heart simultaneously. Your body must compensate almost instantly. In a younger body, this compensation happens in 1 to 2 seconds. After 60, your blood vessel walls have stiffened and your autonomic nervous system responds more slowly. The result is a window where blood pressure drops significantly before your body can catch up. This is called orthostatic hypotension, and research published in the journal Hypertension found it is associated with a 54% higher risk of heart failure in adults over 65. Your heart goes into emergency overdrive within the first 2 seconds of your day, every single morning. The phone part. Here is what that costs you. Within the first 5 to 10 minutes of waking, your brain is moving through the cortisol awakening response, a natural and necessary rise in your primary stress hormone that prepares you for the day. This response is exquisitely sensitive to external input in those first few minutes. When you pick up your phone and expose yourself to news alerts, messages, notifications, and emotional content before your nervous system has even fully transitioned from sleep, you are spiking cortisol at the exact moment it is most vulnerable to being spiked. Research from the University of California found that people who checked their phones within the first few minutes of waking had measurably higher cortisol levels for the entire rest of the day. Chronically elevated cortisol means chronically elevated blood pressure. It means arterial inflammation. It means your cardiovascular system running in a low-grade stress state before you have even gotten out of bed. The coffee before water part. Here is what that costs you. After 8 hours of sleep, you are already mildly dehydrated. Your blood is thicker and more viscous than normal. Thicker blood is harder to pump and more likely to form clots, which are the direct mechanism behind both heart attacks and strokes. Caffeine on top of a dehydrated body during the morning blood pressure surge constricts blood vessels, raises heart rate, and spikes cortisol further. The study in the European Journal of Preventive Cardiology confirmed that the morning hours between 6 and noon account for a disproportionately high number of cardiac events. You are adding fuel to that fire before your first meal. The sitting part. Here is what that costs you. When you remain sedentary in the first 30 minutes of waking, you miss the most important cardiovascular window of your entire day. Your muscle pump, the mechanism by which leg muscle contractions push blood back toward the heart, is completely inactive. Your blood continues pooling in the lower body. Your nitric oxide production, the molecule that relaxes and widens blood vessels and naturally lowers blood pressure, remains suppressed. The orthostatic stress from standing too quickly is not recovered from. It simply sits in your system, compounding the other stressors already present. Now here is the part one need you to stop and think about for a moment, because this is where I want to address the habit that the research identifies as tripling heart attack risk in adults at 60. It is not one of these four things in isolation. It is the pattern, the accumulated, daily, habitual pattern of these stressors combined in the same morning window, the same highest risk cardiovascular period of the entire day, repeated 365 days a year. A landmark analysis published in the European Heart Journal examining morning cardiovascular risk factors in adults over 60 found that the combination of orthostatic hypotension, cortisol elevation from psychological stressors, dehydration-induced blood viscosity increase, and prolonged morning sedentary behavior occurring simultaneously in the early morning hours produced a compounded cardiovascular risk that was significantly greater than the sum of each individual risk factor. The compounding effect of these morning stressors occurring together in the highest risk window of the day was associated with up to a threefold increase in acute cardiac event risk in adults over 60 compared to those who did not exhibit this combined pattern. Threefold, tripled. Not from one dramatic bad habit, from the ordinary, invisible, unremarkable morning routine that feels like nothing because it has never once produced an obvious symptom. I sat across from a man named Raymond last year. 63 years old, had a heart attack on a Tuesday morning at 7:15. He had been to his doctor 6 weeks earlier. Cholesterol was managed. Blood pressure was borderline but not critical. Doctor said, "Keep doing what you are doing." Raymond described his morning to me from his hospital bed. He had stood up fast because he was running slightly late. He had checked his phone immediately and seen a stressful message from his son. He had skipped water and gone straight to his second cup of coffee because the first one had already gone cold. He had not moved from his chair from the moment he sat down until the moment the chest pain started. Raymond was not unlucky. Raymond was the before, every morning, and the morning of his heart attack was simply the morning his cardiovascular system ran out of reserve. I do not tell you Raymond's story to frighten you. I tell it to you because Raymond's morning was not unusual. It was the morning of millions of people reading this right now. The difference between Raymond's outcome and a different outcome is not dramatic. It is 60 seconds here and 30 minutes there, and 1 glass of water and 10 minutes of movement. That is the entire distance between the before and the after. So let me tell you what the after looks like. Let me tell you about the morning that is not currently happening in most senior households, but that could be happening in yours starting tomorrow. Your eyes open, and you do nothing for 30 seconds. You lie completely still, and you let your body register the transition from sleep to waking. You let your autonomic nervous system begin warming up before you ask anything of it. You let your blood pressure start its natural morning adjustment from the horizontal position where it is safe and supported. Then you sit on the edge of the bed, slowly. You let your legs hang toward the floor for another 30 seconds. Your cardiovascular system is already adjusting to the gravitational shift at a pace it can manage. Then you stand slowly, using the bed frame if you want to. The entire sequence took 60 seconds longer than what you did before. Your heart did not go into emergency overdrive. It transitioned. Before you touch your phone, you go to the kitchen and you drink one full glass of water. Not a sip, a full glass, room temperature. Your blood volume begins rehydrating. Your blood viscosity begins dropping. The orthostatic hypotension response from standing begins recovering. And your cardiovascular system has one less stressor to manage in the window that is about to become your first cup of coffee. Your phone stays face down on the counter for the next 30 minutes. Your cortisol is rising naturally as part of your waking biology. It does not spike from emotional content or stressful notifications before your nervous system is ready to process them. Your blood pressure begins this day at its natural baseline rather than at a stress-induced elevation. Before you sit down for breakfast, before you settle into the first part of your day, you move. Not a workout, not a run, 10 minutes of slow, gentle movement, walking through your home, seated leg raises, ankle rotations, calf raises while holding the back of a chair. Your muscle pump activates. Blood that was pooling in your lower body begins returning toward your heart. Your body begins producing nitric oxide in your blood vessel walls. Your arteries begin relaxing and widening. Your blood pressure begins the day lower than it would have been. And according to the research in the British Journal of Sports Medicine, it will remain lower for the next 3 hours as a direct result of those 10 minutes of gentle morning movement. This is the after. This morning exists, it is available to you, it costs nothing, and requires no prescription, and demands no particular level of fitness or physical capability. It requires only the awareness of what the before was actually costing you, and the decision to do something different with the first 60 minutes of tomorrow. I want to be honest with you about something before we finish. I am not telling you that changing your morning routine eliminates cardiovascular risk. It does not. Genetics, existing arterial damage, medication management, and other lifestyle factors all play significant roles in cardiovascular outcomes. What I am telling you is that the morning pattern I described, the combination of orthostatic rush, immediate phone use, coffee before water, and prolonged sedentary behavior, is a daily compounding of cardiovascular risk that occurs in the single highest risk window of your day, and that removing that pattern and replacing it with the one I just described produces measurable, documented, real cardiovascular benefit that your heart will register in ways that show up in your blood pressure readings, your inflammatory markers, and your long-term cardiac resilience. Raymond came back to see me 8 months after his cardiac event. He had made the morning changes I described, every single one of them. He told me that the hardest part had not been the water, or the movement, or even the phone. It had been accepting that something so ordinary could have mattered so much. He said, "I always thought if something was really dangerous, I would have felt it. That is the nature of cumulative cardiovascular risk. You do not feel it, right up until the moment you do." You now know what Raymond did not know before that Tuesday morning. The before is behind you. The after starts tomorrow. Which part of this before and after hit closest to home for you? Was it the standing up too fast? The phone? The coffee before water? Or the sedentary morning? Tell me in the comments below. I read every single one. And if you are making the change starting tomorrow, I want to hear that too. Share this video with someone whose morning looks like the before, because this might be the most important thing they watch today. And subscribe, because what I cover next connects directly to what we talked about today. The evening habits that determine the quality of your cardiovascular morning before it even begins. You are going to want that one.